Hi everyone, welcome back. This presentation will be about immunizations and precautions. But firstly, you can download the templates from the descriptions, and you can modify the template according to your study notes. This presentation is for the purpose of private study and research. The resources I have used include Kaplan's, UWorld, Registered Nurse RN, NCLEX RN, and a few other resources. In my final summary documents, I categorize according to human bodies, according to the topics that NCLEX RN is going to test on. Here for this one, immunization, I put under immune body systems. Immunization can come as inactive vaccines versus active vaccines. This table represents inactive vaccines. So on the far left, these are the type of vaccines, and above here is the time frame that patients or people should receive the vaccines. On here is a note. For example, here I put IPV is an inactive polio virus, but if it's oral, then oral polio polio vaccine is a live vaccine. So you need to know the exception to the rules. Same apply here. With annual flu vaccines is inactive vaccine. But if you give it as an influenza nasal spray, nasal mist flu, then that's an active vaccine. Why we need to know active vaccine and inactive vaccines? Because there are certain group of people that we cannot give active vaccines, like pregnancy, people with Kawasaki, heart transplant, etc., etc. So here is the list of the active vaccines, and those two as well. Those three. How I remember the immunizations for active and inactive vaccines, I just summarize into these 3 points. For 2 to 6 months, you give all vaccines except hepatitis on 4 months, no MMR, varicella, zoster, and shingles. For 12 months, no hepatitis, no hepatitis, inactive polio, and RV. 4 to 6 years, you give IPV, DTaP, MMR, VZV. So given. So I just summarize the whole table. Rather than remember, say, RV, rotavirus, we give it 2, 4, 6. That way there are so many that for you to remember. For transmissions, precautions, I put again under immune body systems. Goes from on the left side, airborne, middle droplet contact, and then far right will be standards which apply to any conditions. We use a standard precaution, so such as washing hands. So when we see a patient, no matter what conditions they are in, we always wash our hands before we go and approach the patients. With airborne, the doors closed, while for droplet contact, the doors open. The mask-wise, airborne, the staff need N95. The patient can use surgical mask, if, for example, if we transfer them to the other department, like X-ray department. For the droplet, staff can use regular face surgical mask. And for contact precaution, you don't need the mask, but you need to wear gloves and gowns all the time. But if there's a risk of fluid spill on the face, then use the mask. For the room, with airborne, you can use negative private room, high efficient particle air filter. For droplet, private room or a group with same disease. For contact, private room or group with same disease. For here, airborne, If you can see the stars, there's 1 star here, 2 star here, and 3 star here. That's what they mean. So if it's 1 star, they use airborne and contact. If they got 2 star, it's droplet and contact. For 3 star, it's airborne and droplet and contact. Because sometimes the NCLEX RNs ask you, for example, for influenza flu, they will say which precaution would you use. So you have to take droplet, contact, and standard. With standard precaution, again, it applies to all the conditions. But what we need to know is, for example, with active singles, we use airborne, but for local singles, we use standard precautions. For active TB, we use airborne, but for latent TB, we use standard precautions. So, for example, I'm going to pop it here. Where are we? So, active TB is here, and latent TB is here. So, latent TB is a standard precaution. Active TB is airborne precautions. Now, next one is they will give you a conditions, a disease, and then say the treatments has been given in certain hours, and then in that way, does the precaution change from, for example, airborne to standard precautions, which the following conditions apply. For example, in pedigos, if after 24 hours of oral antibiotics, then they can go back to standard precaution. But if they are treating with topical ointments, and then that will be after 48 hours, they can go from contact. So impedigo is a contact precaution. If you give, if the treatment has been over 24 hours by oral antibiotics, then that's standard. They can switch to standard precaution. And if they are treated by topical ointments, then that needs to be 40 hours before they can go back to standard precautions. The NCLEX RN questions, it's really interesting because they will ask you about the condition, and then the treatment, give you the treatment hours, and then you pick, is it gonna be airborne droplet contact, or is it gonna be standard precautions? And that's it for it, and I will see you for next slide.